Our names are Ane Opstrup and Amalie Ryner. This is our presentation of our scientific article. The article is written in our final academic year, 2016. We had Dagmar Raymakers as our promoter.
The title of the project is Osteopathic Treatment of Somatic Dysfunction T1-5 and Intrathoracic Fascia and the Impact on Hypertension.
Hypertension is one of the most prevalent and highly risk factor for the health in westernized and developed countries. It can lead to serious cardiovascular complications such as apoplexy and ischemic heart disease, and in the end, premature death.
In Denmark, it is estimated that 20% of the population has hypertension, and in 90 to 95% of the cases, people with hypertension are treated non-specifically. In 95 to 99% of the cases, there are no specific cause for hypertension, and this is called primary hypertension. Secondary hypertension is where the cause is known, for example, renal hypertension and endocrine hypertension.
The patient's lifestyle is of high importance, including physical activity, diet, smoking, salt intake, weight loss, coffee and alcohol consumption, which has a major impact on the blood pressure and therefore are central themes in the treatment approach together with medical treatment. Osteopathic manipulative treatment, referred to as OMT, and spinal manipulated therapy has been reported in different studies and literature over the years to be effective in treating hypertension.
There are some variation in the studies on what effect the treatment has on the blood pressure. Some studies conclude that OMT or spinal manipulative therapy can lower the blood pressure. Some say there are no effects. The intervention consists of 3 techniques and will be described in the following.
Somatic dysfunction T1-5. The sympathetic innervation of the heart has its origins in the cord segment T1-5. The adjustments of upper thoracic vertebra decreases sympathetic tone by way of the sympathetic trunk to heart, aorta and lungs. Segmental lesions of T1-5 can influence heart rate, heart rhythm and heartbeat force.
Intrathoracic fascia. Since the heart is the driving force of the blood pressure, treatment of the intrathoracic fascia is included. The heart is surrounded by a double layer pericardium. The pericardium is suspended by ligaments and is part of the fascial suspensory system and has attachments to the posterior side of sternum. There is evidence that myofascial release technique in healthy subjects has an effect on heart rate, which confirms a relation between manual therapy and the autonomic nervous system. Furthermore, one study proposed that manual therapy promotes autonomic activity, causing vasodilatation, among other things, which is relevant for this study because it causes a decrease in blood pressure.
Recoil sternum. The technique can influence the mediastinum, ribs, sternum, veins, arteries, heart, lung, and diaphragm. It is described as a technique that can stretch the intrathoracic fascia, more specifically in an anterior-posterior direction. These 3 techniques can in different ways influence the sympathetic nervous system via viscerosomatic reflex.
We set up following hypotheses. Osteopathic treatment can lower the blood pressure in people with primary hypertension. And the H0 hypothesis is osteopathic treatment cannot lower the blood pressure in people with primary hypertension. And the research question is, does osteopathic treatment of T1 to T5 and intrathoracic fascia have an impact on blood pressure in patients with primary hypertension?
Materials and methods. This study was carried out as an intervention study, and the study protocol was evaluated and approved by the Ethics Committee. 32 subjects, 20 women and 12 men, participated in the study. The average age was 61 years old.
Inclusion criteria are adults above 18 years old with primary hypertension and somatic dysfunctions in T1 to T5.
Exclusion criteria are diagnosis of secondary hypertension, structural kidney diseases, cardiovascular diseases, osteoporosis, cancer, fracture, positive hepatocellular reflux test. The treatment procedure. The blood pressure was measured before and after treatment. The blood pressure was measured after the standardized procedure by Danish Hypertension Company. They were treated with the 3 techniques according to what there were of findings.
Statistical analysis. The difference in systolic and diastolic blood pressure between tests before and after treatment was analyzed using a paired t-test. P-values under 0.05 were considered statistically significant. Results. The study shows that for all participants, the decrease in systolic blood pressure measured before and after treatment are statistically significant. P-value is 0.0027. There's no statistically significant decrease in the diastolic blood pressure. P-value is 0.1641. For the female participants, there are a statistical significant decrease in the systolic blood pressure. P-value is 0.008, but not in the diastolic blood pressure. P-value is 0.146. For the male participants, there are neither a statistical significant difference in diastolic nor in systolic blood pressure when measured before and after treatment.
Discussion. The study shows no statistically significant decrease in the diastolic blood pressure and a statistically significant decrease in the systolic blood pressure after treatment of T1-5 and intrathoracic fascia. Previous studies shows a decrease in blood pressure after spinal manipulation or osteopathic manipulative treatment. However, the studies are not randomized controlled trials or have an unclear risk of bias. One study draws the same conclusion as this study, with a significant change in the systolic blood pressure, but not in the diastolic blood pressure. We have not been able to find a reason as to why it is specifically only the systolic blood pressure that decreases and not the diastolic blood pressure. A significant decrease in the systolic blood pressure was found, which could be due to the relationship between organ and spinal cord via the autonomic nervous system. Through OMT, we may be able to re-establish the function of the spinal cord and by that have an influence on the sympathetic tone to the heart.
There was no significant decrease in the diastolic blood pressure, which could be due to the fact that the treatment only consisted of T1 to T5 and fascial relations to the pericard. Some studies mentioned lower ribs and the lumbar spine as well relevant treatment as well. We did not ask or change any specific things in the participants' lifestyle, such as diet, physical activity, or weight, and only one treatment took place. This time perspective is rather limited, and in most studies there are more sessions over a longer period of time.
The relative small number of participants can make the result more vulnerable because there are a higher risk that the result will be false negative. The study has no control group, which could have been giving either sham treatment or no treatment. This is a big weakness in the study design because there are no group to compare the result from the intervention group with, and a final conclusion on the result cannot be made. Conclusion. This study indicates that among people with primary hypertension, treatment of T1-5, sternum recall, and intrathoracic fascia gives a statistically significant decrease in systolic blood pressure, but not in diastolic blood pressure. So the hypothesis cannot fully be confirmed or denied because of the mixed results.
The mixed results could be due to the restricted size of the study, both regarding number of subjects, number of treatment sessions, and a limited treatment approach, where we don't address other factors influencing the blood pressure, such as lifestyle. More research, including randomized clinical trials, are needed to document if osteopathic therapy is efficient in treating primary hypertension.